Now, while we don't talk about it as much, COVID cases continue to circulate in Texas and throughout the country. And now that it's cold and flu season, it's time to pay attention again. For an update, we're joined by our medical expert, Dr. David Winter. And Dr. Winter, are COVID cases starting to go down at all this week?
Not much, Tashara. Still a lot of it out there, intermixed with cold viruses, allergy symptoms, and flu's right around the corner. So when you get those symptoms, what do? Well, the government's now allowing you to get free test kits. Go to covidtest.gov. They'll send you a kit. I'm going to show you how these things work. They're pretty easy. They'll give you a swab. You go up one side as far as you can go, twirl it around, up the other side of your nose. Then you take a little tube like this they give you. You put drops in there. You take the swab, twirl it around. Then you put this on the test strip, and then you wait 10 minutes and you have your answer. Pretty easy to do. The test's pretty reliable and it's pretty easy. So get your free test now. Send off and they'll mail it to you in the mail.
It's always the demonstrations for me, Dr. Winter. I always appreciate when you do those. What are you recommending to those who get a positive COVID test?
Well, it depends on how healthy you are. If you're young and otherwise healthy, all these recent strains are pretty mild. 3-4 days, your symptoms usually go away. Now, if you're over age 60, if you have some chronic organ diseases inside, if you're taking immunosuppressive drugs, you might want to consider treatment. And Paxlovid is a current treatment. These are pills you can get. You have to get them at the pharmacy. 3 pills twice a day for 5 days. They work very well. They've been shown to hasten recovery, decrease the chance of serious illness, decrease the chance of death, also decrease the chance of COVID, long COVID. So Paxlovid's available and it works very, very well.
And how safe is Paxlovid? I know I've heard a lot of folks talk about wanting to receive it when they've had symptoms of COVID. Does it have any side effects?
Well, most people talk about the fact they have this horrible metallic taste. Food just doesn't taste right. Sucking on sour candies, I'm told that helps. Peppermint tea, I'm told that can help with that. As far as serious side effects, no. Now, if you have serious liver disease or serious kidney disease, you can't take it. Also, if you take cholesterol medication, blood thinners, antidepressants, immunosuppressive drugs, talk to your doctor. You may need to adjust the dose or stop those while you're taking Paxlovid. But no serious side effects, no.
Okay, always good advice to get your doctor involved with all of this. Dr. David Winter, thank you so much for joining us.
Good to be with you. Thank you, Tashara.